Hello, everyone. I have a wonderful patient of mine. She is 5 days out from her surgery. And you had what are textured implants from 1994, saline implants. Now, what's interesting is in you, the left one was ruptured. There was 22 cc's of fluid. I did the Facebook Live 5 days ago. Specifically, this was on the 9th of July. So those patients who are interested, they can see. So that fluid was all contained. It's sent over to cytology. Anytime there's any fluid around the implant, that must be sent to cytology to rule out that rare BIALCL, which is CD30 analysis must be done. What's interesting is on the 10th of July, I did a similar case with a ruptured left saline implant, and that had no fluid around it. So anytime there is fluid, that's a big red flag for BIALCL, the lymphoma, and it must be checked because it is malpractice to not check. And so everything was contained. I was very happy with how the surgery went. Blood loss was minimal. Now, one thing I want to ask you, you had implants above the muscle. Why?
I didn't want to mess with my muscle. I only wanted to have the emptiness filled back up.
Right, and you're a professional bodybuilder,
Yes.
and this is where you showed me your very impressive pictures and the muscle tones, and certainly, clearly, all bodybuilders get the implants above so as to not cut and compromise the pectoralis function, which is a major part of the upper neck, back, chest, shoulder strength. Now, let me ask you this. 1994, we're looking at Bill Clinton time, right? He was just to kind of put everything in perspective, 2 years into his presidency, if I'm not mistaken. What led you now, this many decades later, obviously you had the rupture that kind of prompted you, but what led you to get a explant and not a replacement?
Oh, well, my nurse practitioner that I had went to, she had moved, and I got a new one, a brand new nurse practitioner, and she examined me and everything, and because I was having so much pain in my joints, in my back, and things like this, and just out of no reason at all, she said to me, have you ever thought about getting your implants out? And it's like this big light bulb went on in my head that like, oh my gosh. And I started adding things up, and that was 6 months ago, and I went immediately home and I started researching. And I had so many of the symptoms. It was amazing.
What were the symptoms?
Oh my gosh, my vision, I had put plugs in my eyes because they were so dry. My joints were extremely painful. My spine was having problems from inflammation on my sciatic nerve, so I wasn't able to walk. So for like a whole year, I had been thinking, what is wrong with me that I couldn't work on my farm? I couldn't be out in my gardens. I couldn't work with my animals or anything. It was ruining my whole life. Mm-hmm. So all the things start adding it up. And
what research did you do? Like, how did you do your research? You went to Google or YouTube, Facebook? What did you do?
Well, I was on. I just happened to be on Facebook, and I think my phone kind of keeps track of what I'm doing or something. Yeah. And so the sites popped up. The breast implant surgery or illness, I should say, popped up. And so I started reading, and it was incredible how many of the symptoms I had. I was amazed at the heavy metal poisoning. Mm-hmm. I mean, being an organic gardener and everything, so I was scared. I mean...
Yeah. So now you're 5 days out. Now let me ask you this. How's your pain overall? Like right after the surgery and the day after the surgery, how was your pain?
My joint pain was immediately gone.
Really?
Immediately.
So where the joint pain where?
In my knees, my ankles, and my wrists were really bad. The pain on my left side from my spine. I mean, I could barely sit because of my spine. I could barely walk because of my leg. Because it's pressing on that sciatic nerve, the inflammation. So the inflammation is going away. I felt a funny feeling on my skin right here and on my face when I started sweating. I mean, I couldn't even sit on my front porch because this heat was making me feel funny. I swear my eye vision is better.
Now I will tell you, look, if you were the first patient I was listening to, I would ask, is it a coincidence that you're improving? No, this is what the many other ladies, literally hundreds of thousands of patients have said. Their vision has improved, the dryness of the eyes, which is the Sjogren syndrome. The hallmark features of breast implant illness are the rheumatological joint problems, right? What else have you noticed? Anything different in the last 5 days?
Well, I think I'm more alert.
Mm-hmm.
You know, like I'm more witty, like I used to be, like instant thinker, you know.
Mm-hmm.
I can find things in my mind easier,
Mm-hmm.
like spelling, and I guess they call that brain fog.
Right, exactly. And you know, as you will see, now this is just the first literally 120 hours or so. We will see in what capacity and how you're going to improve as time progresses. I have to say, just looking at you visually as your skin, you're much improved, like you got like a chemical peel, if you will. And this is also echoed by your husband, right? Your significant other likewise said the same. And I have to say, aesthetically, you clearly did not need drains, and you absolutely did not need that unnecessary lift. Looking at you before and after pictures that I shared with you just briefly, and I'm going to send those over to you, and you will see, you saw the chest wall with the pectoralis major, the fascia of which was removed along with the implant capsule, all of that inflamed tissue. And one just needs to go to the 9th of July 2025 to see the intraoperative Facebook live that was done. Now let me ask you this, could this all be in your head?
No.
How
It's
sure
all
are
in
you?
my body.
Yeah.
I mean, I'm a pretty realistic person.
All right. Now let me ask you this next question, follow up. How sure were you that you were going to improve from this surgery?
Oh, 100%.
You knew pretty much, you were convinced?
Absolutely.
All
That's
right.
why I felt so safe and comfortable. I've been battling anxiety, so that's another issue. I guess it's a symptom. And it was gone. I had no anxiety waiting for the surgery. I just knew that I had to be strong and get through it.
Sure. You know, very well said. I will tell you two things. Number one, most of the patients say these two things. Number one, they wish they had never gotten implants, or they wish they had removed them sooner. Mm-hmm. Look, you did the two and two together. Had you gone to any hospital in the US or any other plastic surgeon, unfortunately, the answer would have been, let's go ahead and take these saline implants out and we'll put silicone implants in. And unfortunately, that is the wrong answer, because you don't want to be dealing with this 10 years out. The other thing I want to mention here is in 1994, you had gotten what were the safer, better, nicer saline implants, which guess what, did the same hurt as the silicone implants. Now, we will continue to hear from you. I will follow you. This is the day 5. Let's go ahead and do this in a couple of months, 3 months. Let's do another follow-up feedback, just so that you can talk to the many other patients who are in a similar situation, and you can make that nice, firm and decision where you were excited about your surgery because you knew your good health basically was awaiting you. And the bottom line here is, do no harm and do it right. That 22 cc's of fluid that was all contained on the left side absolutely did not spill into the chest. And 20 years from now, I cannot imagine anyone doing the surgery any differently. Now, thanks for sharing your journey, and take care and good luck with the T-Rex.
Thank you.
You're welcome.